honored guests, officials from the ICRC, officials from the Bangsamoro Autonomous Region for Muslim Mindanao, officials from the University of the Philippines, friends, participants, welcome to the COVID-19 and Islamic Burials, a webinar, Safeguarding the Dignity of the Dead. This is organized by the ICRC in collaboration with the UP CESO, Center for Integrative and Development Studies, and the Ministry of BARMM, Ministry of Health of the BARMM, to formally start our program. I'd like to request Ustad Abdulhadi Daguit to lead the opening prayer.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir-Rahim. Malik Yawmiddin. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين اللهم اجعل جمعنا هذا جمعا مرحوما وتفرقنا من بعده تفرقا معصوما ولا تجعل فينا محروما ولا مطرودا اللهم وفقنا للخير إنما كنا حسن اتجهنا يا رب العالمين اللهم عافنا من كل سوء ووباء ومرض يا أكرم الأكرمين. Oh Allah, make this gathering a fruitful one. Oh Allah, grant us success to all good things whatever we do, whenever we are. Oh Allah, protect us from all kinds of oods, sickness, and pandemics. Birahmatika ya arhamar rahimin. Walhamdulillahi rabbil alamin.
Thank you, Ustad Daguit, for that wonderful prayer. To give us an opening remarks, I'd like to call Mr. Boris Michel from the ICRC.
Thank you very much. I hope you can all hear me. Thank you for the prayer, and I'm happy to welcome you all here. And I would like to dedicate these opening remarks to our chief guest, His Excellency Mr. Ahod Ebrahim Al-Hajj, Chief Minister of BARMM, and also his Cabinet Secretary, welcoming us today. Our special guest, Dr. Teresa Encarnacion-Tadem, Director of the Center for Integrative Development Study, University of the Philippines. I would like to also thank our moderator, Professor Darwin Absari, Professor at UP-IIS, and also to our closing guest, who will be Dr. Zul Karnain Abbas, Deputy Minister of Health, BARMM, Professor Macrina Morados, the Dean of the Institute of Islamic Studies of University of the Philippines, and Mr. Boris Kelechevich, Deputy Head of Delegation of the ICRC. Dear and honorable guests, officials from the DOH, DILG, BARMM, National Council of Muslim Filipinos, very distinguished professors, ulamas, and my dear ICRC colleagues. I have a great pleasure to welcome you today, all you today, to this important webinar on the COVID-19 and Islamic burials, safeguarding the dignity of the dead. We at the International Committee of the Red Cross, the ICRC, we are honored to be the co-organizer of this event, along with the Bangsamoro Autonomous Region in Muslim Mindanao, the BARMM, and the Center for Integrative and Development Studies, CIDS, of the University of the Philippines. As you know, the ICRC is a neutral and impartial humanitarian organization active in armed conflicts for over 150 years and working in over 90 countries worldwide. Our international mandate is derived from the Geneva Conventions, universally ratified set of rules that aim to reduce the suffering during armed conflict and other situations of violence. The Geneva Conventions give the ICRC the mission to protect and to assist people affected by conflict and to promote international humanitarian law. The ICRC has been present in the Philippines since the Second World War, and for the last several decades has been addressing consequences of internal conflicts and assisting authorities to improve conditions of detention in overcrowded jails and prisons. We conduct our activities in coordination with national and local authorities, maintaining proximity with affected communities and engaging with many local and international actors with bearing on humanitarian situation. This includes training and promotion of humanitarian principles and norms with state and importantly, non-state actors, but also with the academia, religious leaders, health practitioners, and the civil society. With the emergence of COVID-19 in the Philippines, we adjusted our programs to support national authorities, healthcare facilities, places of detention, and the Philippine Red Cross to respond to this pandemic. We focused on populations most at risk from the spread of the virus, such as detainees, displaced and vulnerable people in conflict-affected areas of Mindanao, but also, importantly, the frontline responders. At the national level, the ICRC engaged in a close coordination with relevant national bodies, local authorities, and the World Health Organization, WHO, to ensure that guidelines and policies on COVID-19 response take into consideration the situation in places of detention. We stayed in contact with people in conflict-affected areas and engaged with the parties to the armed conflict to remind them of their obligations regarding international humanitarian law and its provisions most relevant to the COVID-19 situation. We provided also material support, training, and expert advice to support the work of the key health facilities, the Philippine Red Cross, and medico-legal departments. In many parts of the world, the ICRC engages with religious leaders on universal principles of humanity, which are common to international humanitarian law and many religious traditions. In the region of Asia Pacific, the ICRC regularly interacts with Christian, Muslim, Buddhist, Hindu, and other religious leaders and experts. Given that many people die in natural disasters and conflicts, we often focus on dignified management of human remains and provide technical support on work with religious leaders and health authorities on that topic in many countries. You will hear more about our current work in the Philippines during today's presentations. The issue of Muslim burials amid COVID-19 brings many practical challenges. For example, how can BARMM authorities ensure that health and other protocols are in place to prevent spread of the virus? How can ulama ensure conduct of prescribed religious burials rituals? How to ensure safety and dignity of management of human remains in line with humanitarian law and forensic science? Those are many questions. Preparing for this webinar, we realized that these perspectives are converging and they have brought us together out of a common obligation and aspiration to uphold the dignity of the dead and consequently dignity of their surviving family members despite many challenges and constraints imposed by the COVID-19 pandemic. During these converging perspectives today, we hope to bring more clarity with regards to this topic and to put forward practical recommendations for addressing eventual gaps presented by the complexity of the COVID-19 response. We in the ICRC stand ready to provide our technical and other support, working in coordination with the relevant authorities, religious leaders, and all other actors. In closing, I would like to really and warmly thank our co-organizers, teams from the UP Institute of Islamic Studies and BARMM for their determined collaboration on this webinar, hoping that working collectively can achieve our common goal, which is to safeguard dignity of the dead during COVID-19 and beyond. I would like to thank you all very much, and I wish you a very productive webinar. Thank you so much.
Thank you so much, Sir Boris, Michel, the delegation of the ICRC for sharing your experiences with this webinar. Another welcome statement I'd like to call the Executive Director of the Center for Integrative and Development Studies, Dr. Teresa S.
Thank you, Darwin. UP Institute of Islamic Studies and convener of the UP Center for Integrative and Development Studies, Islamic Studies Program, Dean Macrina Morados, Mr. Ahod B. Ebrahim Al-Hajj, Chief Minister of BARMM, Mr. Boris Deputy Head of Delegation for Prevention and Communication, International Committee of the Red Cross, distinguished guests, colleagues, and friends, good morning. On behalf of the University of the Philippines Center for Integrative and Development Studies, or UPCIDS, I wish to welcome you all to this webinar on COVID-19 and Islamic Burials, Safeguarding the Dignity of the Dead. The webinar is part of the 2020 activities of UPCIDS, which is the Research Policy Unit of the UP system. Founded in 1985 by then UP President Edgardo Angara, the UPCIDS is currently under the Office of the Vice President for Academic Affairs. Since its inception, the UPCIDS has sought to encompass various perspectives, methodologies, and ideologies in its conduct of basic and policy-oriented research. Under the strategic trajectory of the university under the current administration, UPCIDS aims to contribute to national development and knowledge creation through enhancing research publications and creative work. Its channels to implement this vision includes lecture forums, workshop, and roundtable discussions, and under the new normal, webinars as we have this morning, as well as publications which include discussion papers, policy briefs, monographs, and the Philippine Journal of Public Policy Interdisciplinary Development Perspective. These are all available in the UP website. To attain this, UPCIDS presently has established 12 programs which constitute the following cluster. On education and capacity building, we have the Education Research Program, which focuses on governance. And for this current pandemic, they have been helping the DepEd come out with modules for the K-12 program. Then you have the Higher Education Research Policy and Policy Reform Program, which basically feeds into the Commission on Higher Education. And again, in this time of COVID, they have been looking at how to facilitate online learning in higher education institutions. Then you have the Assessment Curriculum Technology Research Program, ACRP, which feeds into DepEd's policy processes. And again, they are also part of the policies on how classes can already begin this June. And this June, September, August. And Data Science for Public Policy, which is part of the pandemic team of the University of the Philippines. Another cluster is that on development, which includes the program on escaping the middle income trap, Chains for Change, which links agricultural farmers to global value chains. And in this time of pandemic, they're working closely with the Department of Trade and Industry with regards to agricultural concerns and trade. Then you have the program on alternative development, which documents grassroots initiatives, and they have been mapping out the state of communities under this pandemic in the Southeast Asian region. And the political economy program, which focuses on manufacturing industrial industries, particularly those affected by COVID, and what type of UP researchers can feed into this. And the program on health systems development, which is engaged in community-based health systems. And they are now in the forefront actually at the College of Medicine and the Philippine General Hospital, as well as in the provinces where they have their field sites. The Islamic Studies program is the cluster on social sciences, which also includes the program on social and political change, which is currently doing researches on responses of governance institutions to the pandemic, and the Strategic Studies program, which is examining foreign policy in a time of COVID. Then you have the Decolonial Studies program, which looks into ethical practices as well as alternative practices like herbal, tribal medicines with regards to victims of COVID. UPCIDS also established in August 27 its local regional studies network, which includes the Cordillera Studies program in UP Baguio, which is looking at the impact of the pandemic in the environment in the Cordillera, and the Central Visayas Studies Center, UP Cebu, which is looking into sustainable tourism in a time of the COVID. Of these UPCIDS programs, it is the Islamic Studies program, which to quote from its program rationale, seeks to take the lead in the academe's active role in advancing Islam towards nation building. Furthermore, it aims to encourage a wider context by which Filipino communities can get to know Islam deeper and deal with existing stereotypes of Muslims. Today's webinar is most timely given the topic of numerous deaths associated with the coronavirus. A number of us might have experienced close friends and relatives who unfortunately were victims of this. I can fully understand the pressing need to interrogate the issues and concerns with regards to the management of the dead bodies of these COVID-19 victims. As noted in its invitation, the goal of this webinar is to quote, provide clarity and to gather and articulate recommendations on how to go about this. It is therefore very fortunate that we have distinguished workshop participants from the International Committee of the Red Cross, the Ministry of Health of BARMM, young moral professionals and ulamas among others to discuss the forensics and Islamic points of view in the management of the dead. I have no doubt that there will be indeed an interesting and relevant dialogue on this which will input in policies on this matter. Thank you.
Thank you so much, Ma'am Tessa, Tadem. We are supposed to have another welcome message from His Excellency Chief Minister Ahod Ebrahim Murad Alhaj, but I think he is presiding a meeting, an emergency meeting on peace and council security. But I believe he has a recorded message for all of us. So we hear it.
Assalamualaikum warahmatullahi ta'ala wabarakatuh and good morning. As mentioned by Professor Darwin, the Chief Minister is currently presiding over an emergency meeting of the Regional Peace and Order Council of the Bangsamoro Autonomous Region in Muslim Mindanao. As such, the Chief Minister asked me to read on his behalf the message of the Chief Minister for this very important webinar. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Allow me to extend my gratitude to Mr. Boris Michel, Dr. Alexandra Francis Wright, Sheikh Mahir Gustaham, and the rest of our dear friends from the ICRC, Dr. Abdulhadi Daguit, Dr. Teresa Tadem, Dean Makrina Morados, along with our friends from the UP community, Partners for Peace and Development, ladies and gentlemen, a pleasant morning to all of you. As we continue to battle with the ongoing coronavirus pandemic, governments from all around the world have crafted mechanisms to address stemming issues aside from the obvious health implications. Socioeconomic concerns, blended learning strategies, and adapting towards the quote-unquote new normal are some of the issues usually discussed when problems from the pandemic are raised. However, for Islamic communities, religious practices remain not just a concern, but a priority. While we grapple with the unseen enemy, we must be firm in maintaining practices sensitive to our faith. One prime issue involves Islamic burials for deaths associated with COVID-19. As a community, we should reach out to religious scholars to educate us on how burial is done under the ongoing circumstances. More than anything, however, we should preserve their dignity as humans and as Muslims. The Bangsamoro government, through its regional Darul Ifta, has started providing ways to explain how such burial will be done. But we are also aware that this will be a continuing and evolving conversation based on Islam, medicine, and actual experiences of people working on the ground. Today, this webinar with our friends and partners from ICRC and the UP manifests our earnest desire to mainstream and continue this conversation. inshallah. I pray that this joint effort be of benefit to our community. We are always grateful to serve our people with your respective institutions. Thank you so much and salam.
Thank you, Kabsek, for reading Chief Minister's message for us. Before we proceed with the lectures, we have 3 lectures today. I'd like to announce for the questions and answers will be raised later on after the 3 speakers will speak. But we encourage participants to send their questions, type them in the chat box, Q&A chat box, and then we will organize them together and we will raise those questions later after the 3 speakers have done speaking. So we proceed to the first speaker. She will be talking about the safe handling of mortal remains of COVID-19 victims on forensic science. May I call Dr. Alexandra Frances Starkey, forensic specialist of the ICRC.
Thank you very much. Good morning to you. I'm not sure if my presentation will be shared from your side, or I can share it from this side if that's preferred. Excellent. Thank you very much. Wonderful. Thank you. So, salam alaikum. Good morning, ladies, gentlemen, scholars, colleagues, and all distinguished guests. As introduced, my name is Alex, and I'm the forensic specialist for ICRC stationed here in Philippines. And I'd like to extend my thanks for our invitation to be with you today. Next slide, please. These are the points that I'll be speaking about this morning. I will briefly introduce you to the ICRC Forensic Unit. We will discuss the management of the dead in general principles. We'll look more in depth at the COVID-19 response. I'll highlight some recommendations from the ICRC, and then I will also provide some resources at the end of my presentation. Next slide, please. So first, please let me introduce you to the ICRC Forensic Unit. Next slide. The ICRC's Forensic Unit was created in 2003 as a direct result of the ICRC project, The Missing and Their Families. At the outset, the Forensic Service's main activities focused largely on programs to assist in resolving the fate of missing persons related to conflict. By 2008, the ICRC was designated the lead agency within the Red Cross Red Crescent movement on issues related to management of the dead and forensic science. Today, we are more than 70 professionals that make up the Forensic Unit. We serve as a reference worldwide in the application of forensic science, promoting humanitarian principles, ethics, and laws to meet the needs of the victims and their surviving families. We provide advice, support, training, and access to conferences for local authorities, forensic practitioners, first responders, and all of those involved in all aspects of management of the dead, including the searching for, recovery, analysis, identification, and general management of large numbers of deceased persons in crises. In this diagram, you can see how we are distributed globally. The Forensic Unit's headquarters is based in the ICRC headquarters in Geneva. Each region of the globe is served by dedicated teams of professionals who reside in the countries. You can also see in the middle layer here how our 70-strong team is further supported by external experts through the Forensic Advisory Board and also through partnerships with forensic and academic institutions around the world. As with all sciences, forensic science is constantly evolving, and so it is very important that we are providing guidance and advice that is up to date and relevant. Next slide, please. So now I will very briefly touch upon the key elements that make up the management of the dead continuum. Management of the dead is in a dignified manner is well covered in numerous domestic, cultural, religious, and international laws. International humanitarian law, in particular, covers specific measures that must be observed during times of war and conflict. And international human rights law, acknowledges the rights of the surviving family of the deceased. So when ICRC refers to management of the dead, we are referencing the process of managing the dead outside of normal circumstances, when regular procedures and processes are not sufficient or overwhelmed. It's important that one of the priorities remains to secure the identification of the deceased, to ensure they do not become missing persons. All deaths should be properly investigated. Families should be kept fully informed of the fate of their loved one and the processes that must be undertaken to their body. Proper and documented final rites and final resting place for each and every individual is paramount. Next slide, please. On this slide are some of the key individuals or offices that play crucial roles in the management of the dead. Here in the Philippines, as a result of the unfortunate situation where we experience many natural disasters positioned on the ring of fire, there is already a very efficient system for planning for, mitigating against, and responding to mass casualty incidents, coordinated at a national level. I would like to highlight here that our partners, the Philippine Red Cross, and all of our other national society partners make up crucial members of this management of the dead continuum also. Next slide, please. So when we speak of the COVID-19 pandemic, what are our priorities and how do we adapt these well-established protocols and procedures appropriately? Listed here are what the ICRC Forensic Unit considers to be the key priorities for the management of the dead during COVID-19. First and foremost, the health and safety of staff involved in the handling and management of those who died of COVID-19 is key. They must be specially trained in handling protocols, and they ought to be trained in proper use of PPE. The dignity of and respect for the dead and their families must also feature. Individuals should be properly identified and their whereabouts known throughout the MOTD continuum. Cultural and religious practices should be permitted to take place so long as the previous slide. Thank you. Yes, the cultural and religious practices should be permitted to take place so long as additional safeguards to prevent further spread of the virus, for example, family members wearing PPE and observing social distancing, must still be strictly adhered to. Third, any medical legal death investigation should be able to continue unimpeded by the COVID-19 pandemic. It is possible for medical legal death investigations to occur still, observing special protective measures. Thank you, next slide. So to deal with this pandemic, it is essential that we all understand how the virus behaves. COVID-19 is a respiratory disease caused by the SARS-CoV-2 virus. It is classified as an HG3, which means hazard group 3 pathogen. This is the same classification as we see for TB, tuberculosis, and for HIV. By comparison, Ebola is an HG4 pathogen. This classification demonstrates that COVID-19 does indeed pose a risk to health and can survive for a period post-mortem. But we equally know that by implementing standard safety procedures, this is sufficient to significantly reduce the risk. The risk of infection from handling the deceased is considered to be equivalent to or slightly less than the risk for medical staff treating living patients. Therefore, the following steps should be implemented. The interaction with the deceased should be limited, both in the number of individuals handling the body and in the manual movement of the body. The more a body is moved, the more opportunity there is for infectious droplets to be expelled into the air. Use of appropriate PPE, specific types of PPE should be used for different procedures and handling activities. However, the wearing of these items alone is not sufficient. All individuals should be trained in the proper donning, the process of putting on, and doffing, the process of removing all of these items, because it is through these procedures that cross-contamination poses the most acute risk. I'd like to highlight at this point that there are currently no confirmed cases whereby a living person has been infected with COVID-19 through their involvement with a deceased individual. There was previously one suspected case reported in Thailand, which was published in a very well-respected international journal. But after that publication, after further investigation, the claim was retracted. Thank you. Next slide. So whilst COVID-19 does indeed require special measures, the basic standards and expectations remain the same. Obligations under various domestic and international laws in relation to the dignified and respectful treatment of the dead must still be adhered to. There should not be any unnecessary delays in the collection or recovery of the deceased. Each individual must still be awarded the same care and attention that they would expect in other circumstances. The extra pressures that COVID-19 involves must not risk the identity of the individual from being lost or mixed up with another person. The opportunity for the death should indeed be investigated if necessary. The whereabouts of the individual must be fully and properly documented throughout the process, both for the family's benefit and so that the individual does not become a missing person. This could risk them becoming an unclaimed or unidentified individual. It must remain that the affected family and the wider community are treated with the same respect that they would be with any other death in the community. There should be no stigma attached to the occurrence of COVID-19 within any community. Next slide, please. Every country, culture, religion, family, and individual has very specific beliefs about how they wish or their loved ones would be treated after death. Many practices are ingrained in generations of history and are therefore accepted as the norm. With this COVID pandemic, we are frequently hearing reference to, quotes, the new normal. And we would be wise to acknowledge that funerary customs are also going to need to be adjusted. Grieving individuals and communities require assistance and support from community and religious leaders and academics. These individuals can help guide them during these uncertain times. It's important that the affected individuals are provided with the information necessary for them to understand why certain practices may no longer be possible for their own safety, or why certain other practices may need to be adjusted for the same reasons. However, it is also important for the families of the deceased to still feel empowered. They should be included in the decision-making as far as possible. This is even more challenging in circumstances such as COVID, where governments and authorities are removing many common options for the safety, welfare of the population. For example, in many countries around the world, it is no longer acceptable for families to pay their last respects to their loved one, either in the hospital, mortuary, or the funerary establishment. Therefore, whatever choices remain within these new stricter parameters ought to still be offered to them. Understanding that whilst they may not be able to partake in important rituals and ceremonies, that the professional, it is important that they understand that they may not be able to partake themselves in important rituals and ceremonies. However, professionals and religious leaders can certainly do so on their behalf, and this will undoubtedly reassure the bereaved families. Therefore, trust through transparency and honesty is key. Engage the families in the discussions about what can and what cannot be practiced, who will be present and what will be said. You may find that perhaps the family would take great comfort in a particular prayer being recited or a poem being said. And receiving timely information throughout this process will further help cement the trust in this relationship. Next slide, please. Here, I would like to outline some key messages and recommendations from ICRC regarding the management of the dead during COVID-19. Because of the risks outlined previously, next slide, thank you. Because of the risks outlined previously, it is of most importance that only individuals trained in the handling of the dead in relation to COVID-19 conduct such activities. It's important to note that this is not only for the health and safety of themselves, but also so they do not risk becoming vectors for the disease and carrying that back to their families and their communities. As with many situations, prevention is always better than cure. And so where avoiding the risk of infection is impossible, PPE provides the best defense when properly used. As already covered, bereaved families should still be given the opportunity to provide the final rites for their loved one within the parameters of public health and safety set out by various government institutions. Next slide, please. As far as technical recommendations are concerned, here in Philippines, the DOH guidelines for dictate that burial or cremation must occur within 12 hours of death. Again, these guidelines recommend the limited handling and movement of the dead. It is recommended that the body be placed within an infection control body bag if available, and if unavailable, double-layered regular body bags to provide an extra barrier between the infection risk and the handler. To ensure the individual does not go missing or lose their identity, it is critical that we have the name and the status of the individual clearly legible on the label of the body bag. After sealing, the body bag must be completely disinfected for the safety of the next individual who will come into contact with the body bag. As already mentioned, use of proper PPE will be different depending upon your involvement with the deceased. For body handlers, those placing the body inside the body bag, it is recommended to wear a long-sleeved gown to protect skin and clothing, shoe covers, or alternatively, washable rubber boots, and a surgical mask, but ICRC would recommend the use of an N95 respirator be used for the handling of the body. One should wear goggles or a face shield to protect the face from splashes, and gloves must be worn. These individuals are the most exposed to the virus in the management of the dead continuum. For those carrying the disinfected body bag, gloves and a surgical face mask would be sufficient. As already mentioned, it is important to observe proper donning, dressing, doffing, removal, and disposal of these items. Next slide, thank you. So whilst the authorities and institutions responsible for our health and welfare on a national scale, we do each remain responsible for our own health and safety. We must ensure that we are adequately prepared for our involvement in these situations, and as such, we must evaluate our roles that we are to play and how our role may need to be adapted accordingly. Many families are already having to cope with adapting to this new way of grieving and marking final rites. And it is important that they understand the reasons for doing so. Sharing of proper information and facts is one of the strongest tools we have available to us. It's important that we make ourselves aware and confident in the various government guidelines that have been issued not only nationally, but internationally. This is a global pandemic, and many countries are learning the same lessons that we are. As specialists in our own respective fields, we have a responsibility to engage in discussions together, such as through this webinar, and with lawmakers to highlight any considerations we would feel would be of benefit to the communities and families that we are serving. Next slide, please. Thank you. ICRC employs specialists in a variety of fields in relation to various subjects. For Islamic law and jurisprudence, our colleague Dr. Ahmed Abdulhadi is most renowned for his understanding of Islamic burial rites in times of conflict. He has joined with the forensic unit in Geneva to produce the posters attached, detailing how the rites can be adapted to ensure the practitioners and scholars remain safe during COVID. Some of the key messages include the reiteration that body handlers must be trained in the use of PPE. He identifies that ghusl may still be permitted, dependent upon the various LGU and hospital guidelines locally. However, if ghusl is not permitted, tayammum may be performed instead. For both of these situations, it is important to avoid direct contact with the body or body fluids. DILG and DOH at Manila have stated that no hygienic preparation of any human remains is permitted. This would include the trimming of nails, hair, and shaving. It would also include the occurrence of embalming. Next slide, please. Further recommendations highlighted by Dr. Abdulhadi include that kafan may be performed as normal before the body is placed within a body bag. Thereafter, it is important to ensure the body bag that the body is contained within is leak-proof, fully sealed, properly labelled, and as already stated, that the outer surface should be fully disinfected. However, when performing religious rites, if the body is already contained within a body bag upon arrival, international specialists and domestic legislation already recommend that the body not be removed from the body bag. Instead, kafan may be performed to the outer surface of the disinfected body bag. Naturally, it is important that PPE be properly employed and disposed of thereafter. Next slide, please. Al-Janaza prayer may take place at the graveside, and for this, a minimum of 2 Muslims should be present, both wearing appropriate PPE and respecting social distancing. Domestic legislation does indeed confirm this as well, that adult religious personnel required for a burial are permitted to attend the graveside. Equally, whilst originally government guidelines stated that the remains must be contained within a sealed casket, the edited version of the joint memorandum between DILG and DOH states that the body can be contained either within a sealed casket or within a double layer of body bags for committal to the ground. As far as transportation of the deceased body is concerned, this is only permitted for the purposes of burial or medical legal investigation. Next slide, please. It is internationally accepted that the grave should not be within 25 meters radius of a residential area. The grave should be at least 1.5 meters deep, but the water table in the area should be more than 2 meters below the surface. There should be no opportunity for any body fluids to enter into the local water table. Here in Philippines, the Philippine Sanitation Code already dictates that exhumation for those who died or are thought to have died of communicable diseases may not be exhumed within 5 years. Again, international best practice dictates that graves must be marked indelibly with identification information. Equally, a cemetery map should be created and updated with every burial. Families should still be permitted to visit the grave. once it is safely filled, and they observe regular and relevant protocols such as social distancing and wearing of PPE. Next slide, please. In this final section, I will highlight for you some resources that international bodies, ICRC, and other academic institutions have produced for reference as the world faces this new and unprecedented pandemic. Many posters have been produced, and those shown here are containing basic information for communities and affected families. These posters in Philippines are available both in English and have been translated into Tagalog. Next slide, please. Information posters such as the clip shown here and training sessions have been provided for first responders who are responsible for collecting and transporting the bodies of those who have or may have died of COVID-19. Next slide. Posters and various international articles from World Health Organization, the Center for Disease Control, ICRC, IFRC, and many others have been shared with medical legal professionals who must examine and investigate the deceased. Next slide, please. Internationally and domestically, ICRC has been in discussions with various government institutions and advisory boards, providing information and support to ensuring best practice is maintained within Philippines as we face this situation. The two documents demonstrated here, the first in blue is the ICRC General Guidance Document for the Management of the Dead issued by the ICRC Forensic Unit, and the one written in red is a joint collaboration between the ICRC Forensic Unit and the ICRC Water and Sanitation Unit, WATHAB, where we detail information for setting up, management and maintenance of cemeteries in times of unprecedented loss of life. Next slide, please. Here, I have listed some further documents which I would recommend using for advice and guidance in relation to the management of their dead, specifically in relation to COVID-19. We have the Pan-American Health Organization and the World Health Organization joint issuance, Dead Body Management in the Context of Novel Coronavirus, issued on March 18th. The already mentioned ICRC Forensic Unit's COVID-19 General Guidance for the Management of the Dead, the World Health Organization issuance Infection Prevention and Control for the Safe Management of the Dead Body in the Context of COVID-19, issued on March 24th, and the already mentioned ICRC Forensic and WATHAB units, Protection of Dignity and Respect for the Deceased Individuals in relation to COVID-19. All of these publications can be made available after the webinar if people would be interested to receive them. So finally, to conclude, the COVID-19 pandemic has created an unprecedented public health crisis on a global scale, and it has indeed impacted many different aspects of our daily lives. It's important that we all remain vigilant, but we must all remain flexible as we adapt to this new normal. Indeed, it is clear that there are risks, but we see that by implementing simple steps properly, we are able to remain calm and confident in our different reactions. For the population as a whole, education and awareness are essential to ensuring the spread of the virus remains contained. Preparation and prevention are therefore our strongest tools. If we are able to properly care for the dead, we are also caring for the living by helping them to grieve, come to terms with the loss, and proceed with their lives by accessing the legal and administrative services that they require. Final slide, please. So, thank you all very much for your attention. Salamat. And if time allows, I'd be very happy to answer questions now, or alternatively, we can answer them at the end as suggested. I'd also like to highlight that I have my email address displayed here on this final slide, and I would like to extend a very warm invitation to anybody attending today's webinar. If there are any issues that you would like to learn further information or discuss bilaterally with me, I would be very willing to hear from you yourselves. Thank you all very much.
Thank you so much, Dr. Starkey, for that very enlightening lecture. Caring for the dead is also caring for the living. That's a very good statement. We already received some questions here, but we're going to organize them and read them afterwards. And again, I'd like to announce to participants, if you have any questions, you see a chat box below on your screen. There's Q&A. You can type your questions, but please state to whom your question is addressed to. And please ask questions that are only relevant to the lectures being discussed. Thank you so much. So to proceed, we have another lecturer on Islamic burials in times of pandemic. Let us welcome Professor Abdulhadi Daguit, former commissioner on the National Commission of Muslim Filipinos for Ulama and Senior, and also the current lecturer of Institute of Islamic Studies of UP Diliman. Mr. Daguit, please.
On the Islamic burials in times of pandemic. The outline of my presentation is, of course, the introduction, handling of Muslim cadaver in time of pandemic, shrouding rituals or ghusl, funeral prayer, corrective burial, cremation, recommendation, conclusion, and reference. For the introduction, in Islam, human dignity is a right given by Allah subhanahu wa ta'ala to all human beings who are his vicegerent on earth, entrusted with the mission of creating civilization on earth. Allah granted to them certain rights even before they are born and others after their deaths. Whether they are dead or alive, the dignity and respect required includes that of human body, whether in times of peace, war, epidemics, disasters, or other catastrophes. According to Islamic tradition, the burial of deceased person is a collective obligation of fard kifaya by the Muslim community. The obligation consists of ghusl, ritual washing of dead bodies, kafan, or shrouding the body with pieces of cloth, and finally, salatul janazah, or a funeral prayer. Next slide, please. In Islam, handling of Muslim cadaver in time of pandemic. Handling the remains of COVID-19 victims, whether in Muslim or non-Muslim majority states, Islamic rules developed by Muslim jurists and Islamic authorities must be guided by two considerations. These are the following. Next slide. First, the lives of body handlers, the life of body handlers and rest of the community must not be endangered. The protection of life, or hifdun nafs, is the first of the 5 ultimate objectives of Islamic law and therefore overrides any other Islamic obligations. It is therefore of paramount importance to keep in mind that determining the Islamic position on any of the Islamic burial laws for the victims of COVID-19 is dependent on the available medical evidence on how such a practice could put a life at risk. Next slide. Second, according to Islamic burial rituals, the dignity of the dead and the emotions of their loved ones are to be respected as much as it is practically possible. In extraordinary situations such as armed conflicts, epidemics, pandemics, disasters, or other catastrophes. This pragmatic approach is characteristics of Islamic law as evidenced in the Islamic legal maxims pertinent to the COVID-19 pandemic, such as the following. Next slide. Number 1, harm must be removed. Hardship begets ease, or al-mashaqqatu taglibu at-taysir in Arabic. Necessity leaves prohibition or makes the unlawful lawful, or ad-daruratu tubihu al-mahdhurat. Necessity is measured according to its proportion, or ad-daruratu tuqaddir biqadariha, and matters shall be judged by their objectives. Al-umuru bimaqasidiha. Next slide. Current Islamic burial practices in both Muslim and non-Muslim majority states must be shaped by the available medical evidence and forensic guidelines. However, to date, the medical knowledge and scientific evidence related to the COVID-19 pandemic are incomplete. The guidance provided by Islamic and health authorities in Muslim and non-Muslim majority states and Islamic organizations all over the world therefore differ with regard to the 3 core Islamic burial laws. Next slide, please. Ritual washing or ghusl. The required ghusl or ritual washing of the body can be performed as normal for COVID-19 victims, provided that the necessary protective measures are put in place. Forensic guidance includes wearing complete personal protection equipment or PPE, including gloves, gown, a waterproof apron, face shield, and goggles, and a mask, as well as avoiding direct contact with blood or bodily fluids, making sure that wounds are covered with waterproof bandages, and avoiding contact with the face and mouth, as well as food, drink, or eating and drinking utensils. Next slide. If health authorities conclude that normal ghusl, which include scrubbing the body of the deceased person, could lead to infection, then merely pouring on just spraying water onto the body is sufficient. The guidelines makes clear that all necessary protective measures must be taken to prevent infection, that as much as possible, the burial rituals shall be performed provided that no infection can be transmitted. Otherwise, merely spraying water on the body and what's that? In the body, on the body and shrouding will suffice. Next slide. If spraying water could also lead to infection, the dry purification or tayammum should be performed. If none of the above is permitted by the health authorities, then the body should be buried without ghusl or tayammum. This is not a new Islamic position. In fact, Pre-modern Muslim jurists permitted burials without performing ghusl in cases where the high number of bodies resulting from an epidemic would make it impossible. The autonomous region on Muslim the autonomous region in Muslim Mindanao through its regional Darul-Ifta, the Zamboanga Peninsula and Palawan Darul-Ifta, Supreme Ulama Council of Basilan, and other Islamic organizations, both local and international, have issued recent Islamic opinions to this effect. On the government side, the Department of Health, the Department of Local Government, and the National Commission on Muslim Filipinos in the Philippines, Muslim and non-Muslim majority states worldwide have also issued fatwa or guidelines, fatwa and guidelines regarding this issue. Next slide. Shrouding or kafan. Following the same approach as the previous in the ghusl, as with ghusl, shrouding shall be done only if there is no risk of infection. 3 layers of shroud could wrap the body even from outside the body bag. And if that is not possible, then a single shroud could cover the whole body. What is important is the body must be shrouded with a white cloth. Okay, next slide. Next slide, please. Funeral prayer. The funeral prayer requirement should not constitute an issue in the context of COVID-19 because it can be performed by a minimum of 2 individuals. Furthermore, funeral prayers can be performed at the grave after the burial of the dead. Alternatively, absentee funeral prayer or Salatul Ghaib can be performed on COVID-19 victims. Muslim and non-Muslim majority states have closed masajid or mosque and advise that funeral prayers should be performed in open spaces or cemeteries. They have also advised keeping the number of those who perform the funeral prayer on COVID-19 victims to a minimum and ensuring that the burial can be carried out within 24 hours. Collective graves of the dead. While Islamic law provides that every dead body should be buried in an individual grave, Muslim jurists agree that in case of necessity, such as armed conflicts or disasters, collective graves are permitted. Male and female bodies should be buried in separate graves, but if necessity dictates otherwise, classical Muslim jurist stipulates that a barrier of dust should be placed between the bodies of the male and the female. Classical Muslim jurists also agreed that Muslim and non-Muslims should be buried in separate graves. However, in situations where the religious identity of bodies is unknown, Muslim jurists have disagreed as to whether they should be buried in Muslim or non-Muslim graves, or whether they should be buried in special graves that do not belong to either the Muslim or the non-Muslim graves. The practice of burying the dead in separate graves based on religious identity is still observed in some Muslim majority states and can hinder the dignified burial of unidentified dead bodies if there are no graves allocated for non-Muslim bodies. Next slide. Cremation. Islamic law and Muslim cultures burying the dead in the ground is regarded as a correct way of respecting dead bodies, while cremation is prohibited because it is considered a violation of the dignity of the human body. Cremation of the remains of individuals that have died from COVID-19 has therefore been a great concern for Muslim communities in some non-Muslim majority states. Next slide. Okay, recommendations. We need to remember that we live in a world of amazing diversity and richness of culture and religion. The treatment of the dead in line with those important traditions must not be forgotten. To do otherwise only further undermines their dignity and the needs of the affected community. In the case of Islam, we must seek guidance from those Islamic scholars, religious and community leaders who can best guide us and work together with them to define a response that speaks to those who this pandemic is affecting. This will help ensure that the response implemented is the one that brings assurance or reassurance and comfort to the affected community as a whole, while respecting health and safety concerns. In conclusion, Islamic burial laws and instructions from health authorities in Muslim and non-Muslim majority states are considerably and continuously shaped by the available medical evidence and forensic guidelines, demonstrating that Islamic law is able to adapt to the reality of handling the remains of people who have died from COVID-19. In other words, it is realistic to follow authorities' medical and forensic instructions who also respecting Islamic burial laws. Next slide. Nonetheless, handling the remains of COVID-19 victims could aggravate this global crisis if adequate coordination between health authorities, humanitarian forensics, and Islamic religious authorities does not take place, and if guidance on the burial of the COVID-19 Muslim victims is not communicated and explained to the Muslim public through local imams, the media, and community leaders, a scenario that will allow misconceptions and rumors to persist. Next slide. The refusal to bury the mortal remains of COVID-19 victims is due to the misperception that corpses could spread infection in nearby population centers. This illustrates the need for strengthened cooperation between authorities, Islamic institutions, and humanitarian organizations. More specifically, humanitarian forensic experts to ensure a dignified burial of the dead. Dissemination and communication is crucial, both on the relevant scientific evidence as well as the fact that burying the dead as a collective obligation or fard kifaya in Islam means that the entire Muslim community would be guilty if they failed to fulfill this community or communal duty. That's all. Thank you very much. And Allah is the only source of guidance and success. Thank you very much.
Thank you so much, Ustaz Daguit, for that very clear information on how Islam caters to the concern of burying the dead or those COVID-19 victims. We have now 63 participants, and I'd like to acknowledge the presence of Yusek Abdullah B. Dumama, representative from the Department of Health. To proceed, now we have learned how Islam deals with the COVID-19 victims. We now hear an actual experience of handling the dead body in Zamboanga City. We have Sheikh Mahir Gustaham, Global Affairs Consultant of the ICRC. Assalamualaikum warahmatullahi wabarakatuh. Who will upload the presentations from my side or Professor Darwin? Do you have a presentation? Here is his slide. Yeah. Hello, host. Can we flash Jake Meyer's presentation on the screen, please? In the meantime, maybe you can start sharing your stories. Yeah, it's coming. Okay, here we go. Yeah. Here we go. Yeah. Good morning, everyone. To our head of delegation, to Boris Michel, to the Chief Minister of BARMM, and to the Ministry of Health, the UP, to Dr. Alex, to Boris Kalachibik, and to all my colleagues. Good morning. Yes, please. I think from my side is only the presentation with the pictures that you can see. Before doing this work, we are being trained by the ICRC on the proper donning, how to use the PPE, and how to remove it. In addition to that, Dr. Hussein Sahidjuan, the city health coordinator, is also giving us additional training on how to use it. So this we are about 8 of us in a team for Zamboanga City for the suspect COVID and the COVID positive. So this is as you see in the picture. Next slide, please. This on the training, how to use it. These are the guidelines that we are follow after the discussion with Dr. Alex from the forensic unit and with Dr. Ahmed Daudi, with other religious scholars from Egypt. Of course, from the guideline from we adopt all these guidelines from all just to follow as already mentioned. Anyway, it's already being discussed by Alex, these guidelines, but these are our guidelines. Yeah. Can you just please? Yeah. What we do is like this. After there are someone pass away, then the city health, the health facility will automatically contact the city health, where then the city health coordinator like Dr. Sahidjuan automatically inform us about this. Then we activate our own team. After they inform us, then we will get also the information of the dead body from the city health, especially from our coordinator, Dr. Sahidjuan, Hussein Sahidjuan. Then we will check the names and everything, and then we will also contact the family. So when we arrive to the site, the burial site, we already going to use all the PPE. Then we will check as soon as the body bags arrive. Then we will check the names and everything and other informations for us to have that complete data and everything. So we check the cadaver tab, we check the body bag to ensure leakages cannot occur, something like that. This is our whole picture, okay? This is from the actual situation. Next slide, please. Yeah,
in performing dry purification, since we are not allowed by the city health or by the health personnel to do, the washing and to open the body bags, what we do is the purifications, dry purification or tayammum, where two, sometimes in the body bags and sometimes in the first layer of the white cloth. Yeah, this is the actual one. Next slide, please. Yeah, then the shrouding is, as you see, like this. After we check everything, then we shroud us outside. The 3 layers outside of the body bag. This is the actual in the health facility and in the grave, the burial site. Next. Then we perform the funeral prayers and as in open spaces near the cemeteries and inside the health facility. If you see these pictures, is all us. This is in the actual one, in the actual situations. So we pray within the inside the health facility, and the other one it's the open spaces near the cemetery. Next. Yeah. So this is how we, the body, then after we pray janazah, the body is lowered into the grave, covered by the team, by our team handler. So this is what we do. But of course, we allowed also the family to join us in pray in Salatu Janazah. There's always a family that we contacted. We provide them with the PPE. Either, of course, either the father, the brother, from the relatives, it's always, we always contact them before we do everything. They're also allowed, as from the city health, we are allowed to, at least 5 from the family, from the relatives, but of course they cannot approach us, they cannot pray with us without the proper PPE. But we are always bringing the what we call this, the reserve PPE in case they don't have, then we do have that. We provide them so that they can pray. They can. Most of our situation, we buried more than 30 already in Zamboanga City, from suspect to the positive one. Since, as you know, before we don't have tests, that's why we have a lot of suspected COVID. So we provide them. Of course, this PPE and this equipment is also being provided by the city health to us. So we have reserved, and we provide them also for them, because as a tradition, this is not the normal one. So this is what we do. So even the white clothes, it's not from the family. Most of the family cannot provide because they, it's very difficult to buy and everything, and we provide them, but we are also being provided from different donors for this, and that's it. So next, this is the actual one. Next slide, please. So if you look at it, these are the way we do it. If you look at, there are like cover. The wood cover, that's also we provide that, and most of the case the family cannot provide, so we ask for someone, especially from the cemetery owner, they're also they need to buy for that. For the wood, the small wood, just to cover, because it's not easy to find that in this case. So this is what we do. We follow the tradition. The only exemption that we cannot do is the washing and the tayammum in the skin, because we are not allowed. That's the only. The rest are being taken care of. Next, please. Next slide, please. So after we are being disinfected. As you say, after the closure of the grave, the religious leader and body handlers retreat to the designated area for PPE removal and decontamination hygiene protocol. The vehicle use, transportation is decontaminated also, following the guidelines from the specific disinfectant use. These are from the those inspector, the one who is using the disinfectants from the city health. Yes, next please. Next slide please. As you see, graves are marked. Marked at least with deceased name, date of birth, date of death. So at least as you see, there are some are in the just place of food because it's just new, but we put all of them for the family. Anytime they want to visit, then they can just visit their loved ones they want, and it's arranged. If you look at it, it's arranged. It's just like normal graveyards, normal cemetery. This piece of land is being donated also by one of at least philanthropists here in Zamboanga City. This is how we do it. So as you look at the mark, it's not, do not concentrate on the picture of those. We are the one who's using it. Just look at the mark and how we buried the one who's suspected that positive COVID is just like that. But then we also give the choice to the family where they want to bury their family. We are not going to decide automatically. After I receive the information from the city health, I will contact the family and I will ask them, where do you want to bury your relatives, the dead? And this is because we already discussed with Dr. Alex and with Dr. Ahod and everything, just to follow the old protocols. Then we ask them, and then I will also suggest to them when I know that the cemetery in Zamboanga, the other one is like difficult, then I will suggest to them, this is a very nice cemetery that we're going to do this and that. And then if they agree, then we do it, we proceed. So there are cemetery that we cannot go to the cemetery side because it's a difficult area, but we will perform the tayammum, the shrouding, and the prayer inside the health facility, because there are cemetery where we cannot do anything there inside because it's an overcrowded cemetery. But here we do, as you can see. Yeah, it's already marked and everything. Thanks. Next slide, please. So the practical challenges and our recommendation from the ground, it's the Muslim funeral services. We don't have it. I mean, just like in other places, in other countries, they have that really funeral services, Muslim funeral services. Like here we have Bilia for the Christians, but in the Muslim, we don't have that. So I hope the BARMM will establish in every city and the municipality that at least one theme of the funeral, or a place, if something happened for this pandemic, at least they have that, or in the cities inside the BARMM, or also at the same time in the Philippines. This is a very very, very important one. The Muslim funeral services, we don't have that. If I talk about the Muslim funeral services, it means like Bilia here in Zamboanga, they have complete set. They have car, they have place where they put and everything. Then the next one is the burial site. It's a challenge because there are some communities, because of the lot of misinformation about the COVID-19. So we have problems because there are communities who are very close to the burial site. They said, no, why do you put it this and that? So I think it should be, the BARMM should identify specific burial site for those, especially, so that to avoid this kind of problem. Because we experience here, there are one cemetery, we were going to first to bury it there, but there was from the community, near community, that side said, no, you need to bring to other like that. So to avoid, and we changed that. So this is what the actual situation, challenges that we found. And then the proper coordination and communication between health facility and the funeral team. This is also a challenge for us because let's say, for example, the proper coordination, if we don't have the proper coordinations, it will happen, sometimes the delay. We will wait in the site, but the dead body is not yet being transported, and we wait. As you see, as you know, that PPE and everything, it's it's like, you know, the proper coordination is very, very important from the health, especially health facility. But we are lucky in Zamboanga City Health Officer, which is the coordinator, Dr. Hussein, and our team are really very. We have a strong, what we call this, communications, and we have a good coordination with the City Health. But what I mean is the health facility, which is like hospitals and everything. Sometimes they don't know, they don't have that any information and everything. And there's some cases that let's say the one who transported it is the different name. But we, of course, when we look at the name is different, so we just say, oh, bring it. This is not the one this is not the one. I mean, the dead body that we want. Bring the other one. So there was some communications and coordination. But of course, we lucky our team. Everything we check first. When the dead body, the body bags arrive, we check the name tags and everything, the cadaver tag, and we ask from what hospital is this and that. So this is what we do. But I think there is a need of greater coordination between those. Between those actors involved, especially as I mean, for the clearer messaging for communities affected, and especially there should be an open line of communication or proper coordination between the health facility and the funeral team. The next one is the cultural belief and tradition. So in Zamboanga Peninsula and Sulu Archipelago, cultural belief and traditions is really, really, I mean, as you see that they are not used to do like tayammum. They use the regular one, and they want to kiss the dead body and everything. This is a culture that we have, especially in Tausug and Sama, Yakan, and Maguindanao, Maranao, in the Bangsamoro. So the normal burial, it's really because that's the culture, they want to kiss and everything to do that. So it's a big challenge also for this. That's why most, the traditions and the lack of people to go to the cemetery, to join, it's really, really, really a challenge for us. So from our side, information dissemination and communication is crucial, both on the relevant scientific evidence as well as the fact that burying the dead as a collective obligation. Kifaya, as mentioned already by Sheikh Abdulhadi, in Islam means that the entire Muslim community would be guilty if they fail to fulfill the communal duty. On the standard also protocol on management of the dead, strict adherence to the protocol. This is sometimes, the family, there's a lot of them coming, they want to join. The next is like for us, the lack of resources is one of the challenge for the ground, because we are a new team and lack of resources. So the PPE is really, really a challenge, especially from the very beginning. We are being trained, but the problem is for the BARMM, I recommended the LGU should provide all the medical supplies for the team. So medical supplies, and equipments, PPE, carable bag, mask, gloves, goggles, boots, disinfectant solution, alcohol, bleach, etc. So these are the resources. Sometimes it's not just that one. Our team, we're going from home, going to the burial site. It's also taking, you need to have a motor, you need to have a transportation. It's also a challenge. Then lack of training and manpower. So usually on the ground, we have a lot of imams, in the community, they can just do a call. But in this case, it's different. So they're afraid if they just hear that it's coronavirus patients, I mean, COVID-19 suspect, and most of them, they don't want to handle it. So even in the Ulama Council, in the Darul Istabam, there was no one to volunteer for this. So that's why myself, I volunteer. Of course, I convinced my wife. I did not let my mom to know that I'm going to handle this case, because otherwise she will be, but I did, and I also asked one of my colleagues to go with me, since he also know about this. And for me, I'm confident to do this because I have an experience. I was working in the laboratory as a quality controller at the same time. That's my major. I'm going to do bacteria things, but of course, it's not using the PPE. It's the normal apron and everything as a laboratory. If you work in the laboratory. But then I'm confident because Dr. Alex provided me information about this, trained me about this, and at the same time also from the side of the City Health, like Dr. Hussein and also Dr. Zam, the pathologist here in Zamboanga City. So I asked all of them how to do it and the proper way, and also I train my colleagues and to explain to them, because from the side of the Islamic things I know about it. I have a lot of colleagues like Dr. Ahmed Daudi, Mufti Ismail Menk. We always contact each other. We have contact the Egypt Fatwa Council, I have in Tunis Fatwa Council, so in Saudi Arabia. So I have a lot of that on the Islamic side, but then on the scientific side, I need to have some more. But I'm lucky because Dr. Alex is there for us here, so we did this on the ground. So we need also for the BARMM, I think they should have, since we have a lot of training, I think identify religious leader to be part of the team, because this is very important for the community. If they see that there is no religious scholars, there's no one who is imam or respected religious scholar on doing this, then most of the community, they don't believe, because of course, even though let's say the city health, or the health person is doing this kind of thing, they don't still agree to that, because they want the one who's handling the dead body management is the religious scholar. So that's why sometimes it's a problem. Let's say in Lanao and everything, there's a lot of imam groups in Lanao, and the scholars said, no, why we should allow. So, but the problem, there's a lack of coordination and communication between the health personnel, health facilities, and the religious scholars. If they just want to have this, this is what good for us here on the ground in Zamboanga City. We have a good coordination because we have a big team of the doctors, Muslim doctors in Zamboanga. Around, we have like Unified Medical Doctors Organization. We have Medical Doctors Organization here, which is they agreed to discuss with us, and we were allowed to do our job for this. So from our side, my recommendation from the ground is identify religious leader to be part of the team and willing to be trained and lead the Muslim dead body management. Doping also, it should be very important. At least one medical officer or health personnel should supervise the funeral team, and there should be also a sanitary inspector. So from my side, I think that's it. Jazakumullahu khairan. Maraming salamat po sa inyong lahat for the 63 participants. Thank you very much. Back to you, Dr. Darwin.
Thank you so much, Sheikh Mahir, for taking the courage to be frontliners, and your team for taking care of the deceased body. You are indeed one of those modern heroes. And stay safe, and may you multiply so that many other people can be taken care of. So that's the end of the 3 lectures, and I think we had a very good flow. Dr. Alex gave us a wider concept of forensic science, Ustaz Daguit gave us from the Islamic perspective, and Sheikh Mahir gave us an actual handling and sharing his experiences and some challenges. And we all share your challenges, Sheikh Mahir. So we can now proceed to the Q&A. We have 7 questions. Some of those questions were addressed to Dr. Alex, but Dr. Alex already answered that in the chat box. Maybe I don't need to read them. And we have one left unanswered question. Maybe we can address this right now. This question was raised by Siti Habiba Sarif from the TV program of the government, the Salam TV program. The question is how true that cases in Lanao del Sur after Balik Provincia program is caused by the rapid test, which can be a false positive case because there are instances that the rapid test kits had different manufacturers. Others may be reliable, others may result into false positive COVID. I think this question is better answered by Yusek Abdullah Kamama, probably, representative from the Department of Health.
Yes, I'm here. Thank you very much, Sir Darwin. I'm sorry. I'm really. Assalamualaikum warahmatullahi ta'ala wabarakatuh. I am so glad I've been part of this, and thank you for the invitation. First of all, as far as rapid testing is concerned, I have not heard about the rising case of Lanao del Sur as far as LSIs are concerned because they have undergone rapid testing. But rapid testing, from the point of view of the Department of Health, is not a standalone test. We know that RT-PCR is still the gold standard. We cannot allow the rapid test to stand alone. No? You know, we need a laboratory test, and it's only the RT-PCR that is doing it. So that if ever there are things that you can that you are still in doubt, please come forward and let the Department of Health know that it's happening in the locality. In Davao region, in Davao City especially, Mayor Sara has already verbalized to not to use rapid testing because it's not really used for diagnostic. Rapid testing can only be done maybe, but only if maybe you want to determine if there is already a recovery after 14 days of quarantine, after completing the 14 days of quarantine until 21 days. It is somehow useful if these rapid tests are validated and accredited by the FDA. It's somehow useful to determine if your antibody has already risen and or in the layman's term, the body has defended the immune system already. So IgG should be up or IgG should be positive there. If not, it's still not very useful as far as diagnosis is concerned. But before I go, Sir Darwin, if I may be allowed, is it okay if I be allowed to comment on the presentations?
Yes, please.
Yes, thank you very much. Congratulations to all of the presenters. That's very important. But wala ho ako. I don't have any comment on the first 2 presentations because it has been. I've read that already, and it's and the Department of Health has already issued with the DILG a joint memorandum circular that stating all the guidelines as far as Muslim burial is concerned. But I'm really very impressed by the way Sheikh Mahir represented his way of following the protocols of burials. But as far as the resources are concerned, we want to inform Sigma here that in Zamboanga, we have Zamboanga Peninsula Regional Office in that can provide you with the PPEs that you need. We know the challenges there, no? The cadaver bags, the masks, the gloves, everything that you need, because we have ensured that the will be Sambasuta's needs will be addressed as far as PPEs are concerned, and we have added sustainable number of allocation to Zamboanga Peninsula that can provide that are supposed to be provided to Basulta, because we understand the difficulty of the MOH BARMM to put up a warehouse in Zamboanga, so that we have provided substantial number of allocation already. As far as LGU transport is concerned, for transport of this team, I think the LGU has been tapped to do that, no, to accommodate all of these needs, and they facilitate all these needs, no. As far as training and manpower is concerned, for the Muslim dead body management team, we can, and especially donning and doffing of PPEs, we can ask some Zamboanga Peninsula Regional Office to provide you with the training necessary for you. And then if we can ask one medical officer and one sanitation inspector from the LGU, or if they cannot provide, we can ask Zamboanga City, Zamboanga Peninsula Regional Office of the Department of Health to provide you with one. We know that the predicament, no? We know that it's going to be giving you some problems here, but as far as I know, if you can just coordinate with the Zamboanga Peninsula Regional Office, we'll do our best to provide you all these necessary things that you need. If they will not act on it, just you can tell me personally. Thank you very much.
Thank you so much, Yusek Kamama, for giving some responses, especially on the challenges encountered by Sheikh Mair. You see, Sheikh Mair, if you are modern day heroes, it's not difficult for you to fulfill your hope and your needs in this kind of pandemic. Thank you so much again, Yusek Kamama from the Department of Health. We have another question here from Kamaruddin Muhammad. I think this is a good question. Is there an effort in non-BARMM communities, especially in NCR, with regards to COVID-19 Muslim victims burial? I think this question is best addressed by a representative from the NCMF. The question is not specifically addressed to any of the three speakers. So any of the three speakers can answer it. They have knowledge about this question. Is there an effort in non-BARMM communities, especially in NCR, with regards to COVID-19 Muslim victims burial? Maybe Ustaz Daguit can share some information.
Wala tayong taga-NCMF diyan. Kasi ako, formerly from NCMF, pero I'm no longer connected with the NCMF now. Pero regarding that issue on the COVID-19 dead victims dito sa NCR, ang effort na ginagawa na alam ko is doon natin sila linilibing sa they designate Montalban and Norsagaray cemeteries
in Bulacan. Yes.
Sa Bulacan na doon ilibing kasi Maharlika is refusing to accept COVID-19 victims, except kung taga Maharlika rin, na wala naman nangyari na taga Maharlika na as far as I know na COVID-19 na namatay dito na living. Yun lang ang alam ko na effort doon. Talagang sinisikap natin na with the help of the NCMF, kasi meron silang task force na inorganize, with all the government agencies na line agencies ng government, DOH at saka DILG of course, yun sinisikap nila na lahat ng namamatay na Muslim na suspected sa COVID-19 doon nila dinadala sa Montalban at saka doon sa Norsagaray.
Okay, thank you, Ustad. For the benefit of those who cannot understand Tagalog, he was saying that there were also efforts here in Metro Manila by some religious organizations in collaboration with the NCMF, the National Commission on Muslim Filipinos, in identifying burial sites, which are the one in Norsagaray, Bulacan, and the one in Montalban, Rizal. Thank you so much for that answer.
Sir, can I respond also?
Sure.
Yes, sir. Sorry, but I really need to say this. Gusto ko talagang sabihin to because the NCMF has considerably the MCMS have considerably contributed to some extent by to the IATF in terms of policy and guidelines. No? They have been contributing to this body when it comes to Muslim burial protocol policy and guidelines. They have been part of all of this since the start of ITF, especially when they were able to give some procedures, no? So procedures, especially in if the patient has died inside a health facility, or if the patient has died outside of the health facility, they have considerably given all their opinions timely and accurately. Thank you very much.
Thank you so much again, Yusek Dumama. I think much of the concern here in NCR is being undertaken and addressed by the National Commission on Muslim Filipinos in collaboration with the ILG and the Department of Health. We have another very interesting question here. Is there any case that the family, this question came from Novion Tony Kaharudin. Is there any case that the family members forcefully took the dead body of their beloved one who suspected died from COVID-19 from Health Authority or Hospital Mindanao? This happens in some areas in Indonesia, and the trend is increasing at the moment. The question is not specifically addressed to any of the speakers. So any of the
possibly, the question was: is there any case where there was a instance where relatives forcibly took the relative? Ganun ho ba yun?
Yes. Is there any case that the family members forcefully took the dead body of their beloved one who suspected died from COVID-19 from the Health Authority or Hospital in Mindanao? This happens because this is happening in Indonesia, and he's saying that the trend is increasing.
No, as far as I am concerned, I am handling Visayas and Mindanao, especially hospital operations. I have not heard of anything like that. No, I have not. I cannot recall of a community or relatives forcibly taking out their COVID-19 dead body.
How about in Zamboanga, Sheikh Mayor? Have you experienced some relatives?
So far, there was no incident like that, but it's almost close. Like, for example, if the one is died suspected, then there was like, from the family that they want to handle it. They said, no, we need to, this is not a COVID like this, it's not COVID like that. And there was some incidents here, actual incidents that we are lucky that already being swabbed, that there was a swab test being done to that, particular dead body. Then we wait. We always wait. We wait for the result. That's why we, like, for example, usually we go do our burial on 10 o'clock, like that. But then we will increase the time up to the result, of the test. So there are two incidents already that the result around 10:30 to 11 o'clock, then the result was negative. Then the family bring that because they did not allow to have. They want to wait for the test. But we are lucky because we already have tests in Zamboanga City. Otherwise, if not, it might be had some issue. And at the same time, there was also one incident that the one they said from Basilan issue, from Basilan that they said, no, this is, he just fell from the mango tree. And then, yeah, you see, you hear
I heard that
this.
too.
You heard it. But of course, the doctors, they know anything that is being, because there was no test being done and everything last time. So that's the information it's being like viral in the social media, but it was, that's the only thing. Yeah, I think so. There's no really like they want to grab it, but there are like they don't want to give it to us. They want to wait for the result, something like that.
Thank you so much, Sheikh. Since we have exceeded our time, maybe we can entertain one last question. This question is addressed to Sheikh Maher. It was your group and your team who handled the bodies of COVID-19 in Zamboanga. May I know if you were tested for COVID-19? Maybe if you have undergone swab or rapid test. Sheikh Maher, your speaker is
okay, sorry. I'm sorry. We have not yet done the test for our team and for myself. We don't have that because I think we follow all these things. But if there is an offer for that, we are willing to have that test. Inshallah.
Thank you so much.
Can I respond to that? Can I respond to that, sir?
Okay.
Yeah. How many of the team do you need to be tested, sir?
So far, actually, we are 8, but the one who is working, we are only 5.
Okay, because although you're not included in the subgroups, but I think you're also frontliners. So if you can just give me the name and I can ask Region 9 to do the RT-PCR as soon as possible.
Thanks. Thank you.
Thanks.
And if I may, from the ICRC perspective, I would like to add here that all ICRC colleagues, frontliners who have been working in prisons, who have been exposed potentially to the COVID, have been tested, also to show that you can be a frontliner and operate safely. And it is true for Sheikh, who is working as a consultant, and also because until recently it was difficult to test the people in Mindanao. Now it's improving. I'm very grateful that the BARMM Ministry of Health can offer Sheikh and his colleagues the possibility to be tested to make sure that everybody is safe, and also to reassure all the others who may have doubts that we can operate safely. Thank you.
Thank you, Sir Boris. Maybe I need to read this one last question from Sir Boris Kelsavic. This question is addressed to Yusek Dumama. Sheikh Maher hinted at reluctance of some people to be involved with management of the dead of suspected COVID-19 victims. Have you noted stigmatization related to health workers and other respondents?
Oh, yes, it's everywhere. You know, it's everywhere, especially in the hospitals where there are positive cases of health workers. In Davao, we have been receiving reports that nurses assigned in the isolation wards and ICU in SPMC and some other government hospitals were forcibly thrown out of their boarding houses. And what we did was to provide them with the accommodation that they need. We rented some apartels, we rented some hotels. The government has paid for it. This is it's everywhere actually. However, it is starting to wind down and flatten up because we've been out doing our risk communication as far as the OH is concerned. This communication is now a very good tool to at least somehow soften the stigma that they have been espousing out as far as health workers are concerned. So it's even us here. If you're from the Department of Health and if you're from the hospital, there seems to be a little reluctance in talking to these people, especially the ones really providing direct health services to our COVID patients in SPMC.
Thank you, Dumama.
Thank you very much.
I think that ends our Q&A. For those questions that were not read online, because they were already answered in the chat box by some speakers, this will be all posted in the proceedings that we will later on and post later on. So we go to action points. We have three people on the line. We have representatives from the BARMM. Dr. Zulkarnain Abbas is a member of the parliament and at the same time Deputy Minister of Health. We also have Professor Macrina Morados, Dean of the UP Islamic Institute and the head convener of the CIDS Islamic Studies program. And then we have Mr. Boris Kelesevic, the Deputy Head of Delegation of the ICRC. So maybe we begin with Dr. Zulkarnain Abbas.
Okay, so Bismillah ar-Rahman ar-Rahim. Wassalatu wassalamu ala Rasulillah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Good morning to each and everyone. I would like to thank the organizers, the International Community of the Red Cross, ICRC, Bangsamoro government, and of course the UP Institute of Islamic Studies for this webinar. The presentations are all excellent and very clear and offers great insights as to the proper handling of the Muslim remains, particularly those who died due to COVID-19. So the presentations all detail these processes. First, for the action points, I would like to suggest for the MRLs, particularly the Darul Ifta, to convene and have a uniform fatwa or religious ruling on the handling of the remains. Though there are fatwa issued, but there is I think we need to have a comprehensive guidelines on the handling of the deceased, and also there should be a review of the processes of handling the disease at the moment and aim for very minimal interaction with the body, because there are ways, like for example the one presented by Sheikh Mahir, in which they lower the body in the grave. There are ways that that could be minimized. I think the processes should be reviewed. Okay, so I think there is also a need for the Muslim religious leaders, the Darul Ifta, the NCMF, the DILG, the MILG, the DOH, and the MOH to disseminate the current guidelines and the fatwa on the proper handling of deceased bodies to all the masajid, to all the mosques, and the Muslim religious leaders in the country, especially in the BARMM area. So I think there should also be the handling of the remains should also be institutionalized, such that there should be an agency who handles these bodies. At present, we have capacitated some MRLs in the provinces, but in case there is a surge of death, we should be ready. No? At the very least, training for the MRLs and the health professionals at the LGU level about the proper management of the dead should be conducted. The recommendations and guidelines being or mentioned here shall be emphasized in these trainings. So after this, there should be, I think there should be training on the procedures, especially infection prevention and control, training for the handlers of the deceased bodies. So other than the fatwa, I think there is a need for government institutions to provide resources such as PPEs. These are provided by the Department of Health, the MOH, the alcohol, the masks, and others. But I think most importantly, we need to provide transportation for the purpose of handling COVID-19 remains, such that there should be COVID-19 dedicated ambulances, vehicles for the deceased, no? Because we cannot just transport the deceased in ambulances or any private vehicle. We need, I think we need COVID dedicated vehicles for that purpose. So Alhamdulillah, because the important stakeholders are here. USEC Abdullah Dumama is here. The NCMF, the spokesperson of the Bangsamoro Interagency Task Force, Cabinet Secretary Stin Pendatun is here. Our partner INGOs are here. And inshallah, we will be able to relay these concerns, plans, and recommendations to the appropriate agencies and the agencies concerned. Again, thank you very much for inviting us here. And we look forward to continuing collaborations with all of you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam. Thank you so much, Dr. Abbas. We proceed with Professor Macrina Morados, Dean of the UK Institute.
Okay, Assalamualaikum warahmatullahi wabarakatuh. And I think I would like to use this time to extend my thanks to the organizers of this webinar, to Cabinet Secretary Asnin Pindaton. Thank you very much for positively accepting our proposal to collaborate with you. And of course, our longtime partner, the ICRC. And we have really achieved our goal to make this webinar, if we start to do some policy recommendations, which is really the role of the UP Institute of Islamic Studies under our CIDS program, Islamic Studies program. So we have observed that in the first wave of the report of people affected by the COVID-19, there were, I think, in the first batch, the cases were identified as Muslims. If you remember, they were from Green Hills shopping mall in Metro Manila, and then thereafter there were several cases were noted, and there was really a problem on how to handle the cadaver of Muslim deceased Muslim, no? And I think here in Metro Manila, I invited one of the director of the Las Piñas Muslim Consultative Council and also the Muslim Consultative Council in Quezon City, because of the need to really set up a hotline where Muslims can directly connect with the NCMF and DOH when there are cases of Muslims, no, who died because of COVID-19. Because I noted one case last month that the family had hard time in getting the cadaver in the hospital. They were asked to pay the hospital bill, and you know, Muslims should be buried, no, in less than 24 hours, and we noted that we have the guidelines from the DILG, from DOH, but I think there's a need to disseminate this information, and this is one of the tasks of our program. And then I also noted, while we are addressing the need to have this seminar training for those who will handle dead Muslims, I think we have also to take it very seriously, information regarding COVID-19, its prevention, because I see Muslims psychology is very dependent on some, you know, the Qadar, the Islam, and they are not taking COVID-19 seriously. Even here in the community where I lived, people will tell you it's useless. If Allah will, you will be afflicted, then you cannot do anything. You know, that kind of attitude. And we have to come up with information like materials, and I'd like to call the attention of the ICRC to, you know, to provide us more of the IEC materials. And it should not only be in the website, but it should be distributed in the community level. And I think we can also distribute in the remote areas in the BARMM. And another thing that I noted in my recommendation is we need to continue the support of providing relief assistance to the Muslims affected by the, you know, by the lockdown, by the safety measures implemented by the government. Because we have to look at, you know, the reason why Muslims cannot be advised to stay at home, because of, you know, it's always attached to other social problems, like, you know, here in Muslim compound, most of the Muslims here are dependent on daily income, you know, they are daily wage earners. So you cannot tell them stay at home because they really want to go out. And I think as we have here the concerned agencies that can address this concern, that we have to be always look at cultural sensitivity, cultural issues, especially in implementing, like, for example, our relief services, because it's always been the complaint of the Muslims. They are receiving items that contain non-halal items, no? So I'm raising this issue, although this is not related about handling the dead, but we have to be practical. While we give importance in respecting the dead, but we have also do something, you know, to help our Muslim brothers and sisters. And you can count on us, the UP Institute of Islamic Studies. We will continue our partnership because I see the need to do more regarding this. And also allow me to thank the participants who accepted our invitation. All concerned agencies are well represented, and really thank you very much. And you can look forward of the, you know, posting of the video of this webinar, and this will be in collaboration with the Office of Secretary Asnin and the Office of the ICRC and the UP-CIDS. So with that, Assalamu alaikum. Thank you very much.
Alaikum assalam. Thank you also, King Morados, for that recommendations and some encouragement. May we hear from Mr. Boris Philosophic, Deputy Head of Delegation of the ICRC. Yes, Sir Boris.
Thank you, Darwin. Good afternoon to all participants, to all panelists. We all learned something today about these very, very important issues at this time under the COVID. When we discussed for the first time with Dean Morados, it was in May when she proposed organizing something, seeing how much information is missing and how many issues need discussion and clarity. We decided to try to organize this webinar. I'm very happy that we have managed for these 60 participants today to have this very interesting discussion. I think our goal was to provide some clarity on these issues from the forensic science perspective, from the Islamic perspective, of course, and very importantly from the field, from Sheikh Mahir, who has been at the forefront, is really at the front line on this issue, has provided a lot of issues that hopefully the ICRC was able through Dr. Alex and other colleagues to provide some guidance, support, technical advice, and training that would ease the work in the field. I think these valuable insights are there to stay, and I think it is very good that we are going to have a recording of this webinar that will be available. We will share it with all participants. We have all your email addresses. If any questions that were not answered directly here, you will be able to see them either in the posts of BARMM or UP Islamic Institute or the ICRC platform. So stay tuned for receiving the complete information after that, which then can lead to other discussions that we have touched upon today. And clearly there were some issues that were highlighted by all speakers. It's the need for coordination, for communication, for complementarity between health authorities, between religious experts and practitioners, between humanitarian workers and forensic science experts. So this is really very much about, as Dean Morado said, about communication, about awareness. The more information we are able, or correct information, the right information to be circulated, I think we are reaching the goal. We are very happy. As I said, we first wanted to have collaboration between Institute of Islamic Studies and ICRC, but then it was very, very convenient that BARMM has taken on this initiative, and I would like to thank Cabinet Secretary Asnin for offering this platform that we could involve more people than initially planned, and of course with these technical arrangements, we are going to be able to reach even more once we have the recording of the webinar. And we are looking forward to continue our cooperation with BARMM, because it is very important that the authorities and the health authorities are those who are having the lead role and providing the guidelines, which we can provide with some technical support, but you are there to lead the process. I also want to say on behalf of the ICRC, thank you very much for participation to our colleagues also from the field. We have offices in Cotabato, Iligan, and Zamboanga, who are possibly your first port of call if you are in Mindanao, in BARMM, to see whether you need some assistance, guidance. So of course, here in Manila from Dr. Alex and others, we can also provide support, but we have people on the ground who have the understanding of the situation and can provide support quickly. So they are at your disposal as well. So from my side, I would end here. I would thank all the speakers, all the panelists for all the questions. And I think this webinar was a great success for us. It's the first one. And I also want to congratulate Darwin, because it is the first time that he moderated. We promised 100 participants. Maybe the next time, Darwin, you can have even more. But from my side, on behalf of the ICRC, thank you all for participating, and looking forward to see you, to hear in some other webinars organized together. Thank you very much.
Thank you so much, Boris. Yes? Again, thank you so much for our partners, the Ministry of Health of the BARMM, the ICRC, UP Center for Integrative and Development Studies. We thank you for the participation of the of USEC Dumama and other important people. And we look forward for a more substantial result from this webinar as we go on to face the challenge of the COVID-19 pandemic. Once again, thank you so much. And that ends our webinar. Assalamu alaikum.